I think the best part of this conclave has been the fact that they have managed to highlight all the different aspects on all the different facets of the fertility industry. And so when we were looking at the equity people and the investments into fertility industries, now we are looking into the technology and the advances that the fertility field is seeing. So I think the conclave, in terms of different places, that they have actually managed to pick out the right essence of the fertility industry and the different facets. So it's important for us to have a holistic view of everything, not just one aspect. So we really need to see where the industry is heading towards, and what should we be looking out for, and how do we keep ourselves ready for what's coming next. See, even though it's an extremely populated country, it also means that the number of couples who are actually seeking fertility treatments is also therefore high. So even though it is paradox, but that's the reality, and we have to be ready for that, and we have to see how best we can actually accommodate the services for the kind of economic strata that India actually has. So even though being expensive, only approximately 20% of the people who actually need treatment are accessing the services, whereas you have at least about 75 to 80% who are not able to access the services because of the cost factors, and also about the logistics as to the availability of the services in the area that they reside in, and all so on and so forth. So we have to really look to see how best we can make this more accessible and also affordable. I think in terms of where we are, there are a lot of things that India has actually caught on, and where we are contributing towards science is like working in stem cells, understanding whether there can be any applications of stem cells in the research. There's also been a pioneering aspect of uterine transplantation that has happened in India as well. So we are literally there in the forefront, but yes, there's a lot of work that still needs to be done. The potential is there, but like I said, the factor that actually limits the usage of the facility is mostly the affordability of the majority of the couples who actually need the treatment. To a certain extent, maybe we are bridging the gap for accessibility, but I think we still have a long way to go before we can make it affordable to most of them. I think it's important that this conclave has managed to bring everybody from the different aspects of the fertility industry together, so that we can understand the challenges and the advantages of the industry and where it's actually moving towards. And also, it's not just about the industry, it's also about the others, in the other healthcare, let it be the healthcare sector, let it be the investment sector, let it be the technological side of things, for them to realize that India is where, in terms of coming across and moving forward in this space is there, and obviously there needs to be a lot more work done.